Christmas is around the corner, but Europe is not preparing for any kind of festivities. Instead, the continent is now imposing strict restrictions amid a rise in Covid-19 cases. This has further been fueled by the new Omicron variant. We begin with Belgium, which has now toughened its coronavirus-related norms for the third consecutive week. Mask mandates have been extended to children above the age of 6. Earlier, kids above the age of 10 were required to wear masks. The decision was taken later after a rise in cases among children especially. Shifting our focus now to France, which has reported 55,000 new cases in the last 24 hours. It has also confirmed at least 12 Omicron cases. People continue to go out for Christmas shopping. However, fears remain of the new variant. Vaccination centres have confirmed an uptake in appointments as cases rise. Meanwhile, in the UK, Prime Minister Boris Johnson received a booster shot. Johnson encouraged people to get the third dose. He vowed to offer booster shots to all adults by the end of January 2022.
That is booster jabs in this country, so we're building ever higher the wall of protection. Whatever Omicron may or may not be able to do, it certainly will not negate the overall value of the booster.
Spanish authorities have been rolling out new measures to avert a fresh wave of infections. In Barcelona, residents must now show a COVID pass to enter gyms, restaurants and swimming pools. Spain earlier announced travel curbs on southern African nations. The number of flights to the region has now been reduced. Europe has been battling a rise in cases even before the Omicron variant was detected. Many of these cases have been reported among the unvaccinated. This has sparked countries, including Germany and Austria, to impose severe curbs on people who have not yet been vaccinated. Now, for more on this, we are now being joined by noted virologist Professor Amos Panett. Professor Panett is one of the leading virologists at Jerusalem's Hebrew University. Professor, thanks so much for joining us on WION at this hour. Now, my first question for you, while the symptoms of Omicron are mild, the new variant is believed to be more transmissible. We're now also getting reports of a similarity in the genetic material in Omicron to the virus which causes the common cold. So what, according to you, can we do to mitigate risks of infection?
Well, first of all, there is new data that the Omicron is probably a recombinant virus, meaning that it got some sequences from another coronavirus, a distant relative of the Omicron, which is non-pathogenic or very, very mildly pathogenic. So this is not a reason for concern. What we know is that in South Africa, the Omicron is spreading quite fast. In Israel, where we have now the Omicron, it spread, but not very fast. And we don't have any spike in infections. Also, there is no indication that the Omicron is more pathogenic. So there is no reason to be panicked about the Omicron just now, even though it may spread a bit faster than the Delta strain. So I would suggest caution, and we will have to wait a week or 2 weeks before we know more whether to take new measures, kind of extreme measures, or we can just keep on going with the same measures that we have now, masks, distance, personal distancing, and continue life. I don't see the reason for panic at this point, and I don't agree with closing borders also. Although my government, the Israeli government, has closed the airport to Israel, I don't think that it will help because Omicron is already in Israel, and if it spread fast, it will overcome the Delta anyhow.
Right. Professor, thank you for clarifying that. It's very important at this stage not to panic and to separate the facts from the hysteria. Now, that brings me to my next question in reference to what you just mentioned. The discovery of this variant has come right ahead of the holiday season, of course. The WHO has said that travel bans will not alone help in curbing cases, which is something you just said. So what's your opinion on the same?
Well, my opinion is that we have to work hard, and my laboratory is working very hard to see what is the difference between the Omicron and the Delta, and whether these differences should kind of put an alarm that we have something new, completely new. I don't think that people should travel freely, if they have to travel, no way, they have to travel. But if they just go for holidays, they better wait a week, at least a week, and see what's the outcome with the pathogenicity of the Omicron and with the speed of spreading of this variant.
Absolutely. Professor, my final question for you. Let's talk about vaccination efforts now. Different nations are considering vaccine mandates in light of the new variant. So what's your opinion? Will vaccine mandates work in tackling this new variant?
Well, vaccine mandates is related to the corona pandemic in general, not to this specific variant. And it's a very difficult question. I know that some countries are considering mandated vaccination. In Israel, we don't consider it. We don't think that it will help. There are people who wouldn't get it. You cannot put them in prison because they don't want to get vaccination. We have to explain. We have to give education. That's the way to go. I'm against mandatory vaccination. I think it's counterproductive, and in democracy countries, it's kind of too much. It's going against human rights.
Right. Professor, thank you so much for joining us on WION at this hour, and thank you so much for all your inputs. WION World is now available in your country. Download the app now and get all the news updates on the move.